Diabetes. What is it? Diabetes is a disease that occurs either when the pancreas does not produce enough insulin, this is diabetes type 1, or when the body cannot effectively use the insulin it produces, this is diabetes type 2. Insulin is a hormone that helps to lower blood sugar by storing the sugar into cells as fat or energy. Prolonged high blood sugar will cause insulin resistance, which in turn will cause diabetes. Over time, diabetes can lead to serious health complications. The number of diabetes cases is on the rise. There are more than 422 million adults having diabetes, or 1 in 11. Each year, around 3.7 million deaths are due to diabetes or high blood sugar. 1.5 million deaths are directly caused by diabetes. What are the types of diabetes? Type 1 diabetes make up 10% of all diabetes cases is when the body does not produce enough insulin. Type 2 diabetes make up around 77% of all diabetes cases. It is when the body produces insulin but can't use it well, mainly due to insulin resistance. Type 3 or gestational diabetes make up around 12% of all diabetes cases. It is a temporary condition in pregnancy. The last type, or type 1.5, is a combination of both type 1 and type 2, which make up around 1% of all diabetes cases. Consequence of diabetes. Diabetes can lead to complications in many parts of the body and increase the risk of dying prematurely, such as stroke, blindness, heart attack, kidney failure, amputation, high blood pressure, and weight gain. This is a blood sugar and insulin pathway. First, eating food, especially food with high carbs. The carb changes to sugar or glucose after digestion and enter the blood. The pancreas senses the rise in blood sugar, produce insulin. The insulin helps sugar to enter the cell to generate energies. Unused energy will turn into fat. This is why insulin is often called the fat hormone. Progressions of type 2 diabetes or the twin cycle. Consumption of high carb, high sugar, and processed food and snacking or eating all day will cause prolonged rise in blood sugar. The pancreas will produce insulin to move the sugar into the cell as fat. In time, this will cause fatty pancreas and livers and weight gain. The fatty pancreas will not be able to produce beta cell, which will prevent the body from using or burning the fat. With too much fat in the cell becomes insulin resistant, which leads to requiring more and more insulin. Insulin resistance will lead to type 2 diabetes. Insulin resistance is an overflow phenomenon. In normal situation, when you eat, your blood sugar will increase. The pancreas will produce insulin, which will store the sugar in the cell as fat. However, when you have prolonged high level of blood sugar, you will need more and more insulin to push the sugar into the cell. However, if the cells are already full, even with more insulin, the cell would not be able to take more sugar. The cell then becomes resistant or not responsive to insulin. This is called insulin resistance. So what are the signs and symptoms of diabetes? They are 1. Always tired. 2. Frequent urination. 3. Sudden weight loss. 4. Wound that wouldn't heal. 5. Sexual problem. 6. Always hungry. 7. Blur vision. 8. Numb or tingling hands or feet. 9. Always thirsty. And 10. Vagina infection. So what are the risk factors for type 2 diabetes? Genetic, age, and family history of diabetes can increase the likelihood of becoming diabetic and cannot be changed. However, some behavior that increase risk can, such as unhealthy diet from consumption of too many sugary and or processed food, frequent meal, or in other words, snacking and eating all day, which causes the rise of insulin level throughout the day. Fatty livers and pancreas from consumption of sugary food and or alcohol. And lastly, being overweight and inactive. So, what can we do? These are the key actions. For everyone, you and me, diet. Know what and when to eat, like eating low carb diet and practicing intermittent fasting. Be physically and mentally active. Keep and maintain healthy body weight. Check blood sugar and blood pressure regularly. Do regular health checkup for government and organization. Allocate funding to support healthy and active aging. Improve diabetes service with respect to diagnosis, treatment, and care. Have proactive policies like taxes on sugars, alcohol, and open space urban planning requirement policy. Thank you.